everyone. So the next topic which we will be discussing here is about the disorders of the respiratory system. So what is respiratory system? It is it consists of various organs or a network of organs where the exchange of gases takes place. There is a oxygen and carbon dioxide. These are the two gases which are involved between the atmospheric air, blood and the tissue cells. In addition to this functioning of the gaseous exchange, that we take in the oxygen and give out the carbon dioxide, the respiratory system also helps to regulate the blood pH and contains receptors for the sense of smell. And it also filters the inspired air. It produces the vocal sounds and they excrete small amount of water and heat. So if there is any if there will be any disorder related to the respiratory system, or if there is any dysfunctioning which is related to the respiratory system, that will cause many problems, or there can be many disorders which can be involved in the respiratory system. So let's see what are these disorders. So I have introduced the definition of the respiratory system already. So it is a network of organs and tissues that helps you breathe. So it includes your airways, lungs and blood vessels. So there are various respiratory organs which are involved in the exchange of the gaseous exchange. So the muscles that power your lungs are also the part of the respiratory system. So the windpipe, the nose, the lungs, see, all are the parts of the respiratory system. So these parts, they work together to move oxygen throughout the body and clean out the waste gases like the carbon dioxide. So this is the main function of the respiratory system. Now, what are the disorders of this respiratory system? So respiratory systems or respiratory diseases, they can be caused by various number of things. For example, it can be caused due to the infection, by smoking tobacco or cigarettes, by breathing in second-hand tobacco smoke. Then there are various forms of air pollution which can also cause the disorders in the respiratory system. Now, what are these disorders? So these are the number of disorders that are involved in the respiratory system. So first is the chronic obstructive pulmonary disease, that is also called COPD. Then the asthma, then emphysema, bronchitis, pneumonia and tuberculosis. So these are all the disorders that leads to the problem in the respiratory system. So first we will discuss about the chronic obstructive pulmonary disease. So here is a diagrammatic representation of the disorder. So first we will discuss this, that chronic obstructive pulmonary disease or COPD, it refers to any disorders that cause airflow obstruction primarily due to the narrowing of the airways. So as you can see in this figure also, that this is a healthy airways which has been representing, and there is an inflammation and excess of mucus in the chronic bronchitis. So obstruction, which means the airflow obstruction is there, which is due to the narrowing down of the airways. So there is a narrowing down of airways which has been seen. So the main symptoms, it includes the shortness of the breath and cough with sputum production. And the major COPDs, they are asthma, chronic bronchitis and emsemia. So these are some of the main CPODs, that is the chronic obstructive pulmonary disease disorders. So this was about the COPD. So the next we will discuss about is the asthma. So asthma is a chronic lung disease which is characterized by the inflammation in the airways. So as you can see here in this slide also, that there is a normal lung and there is a asthmatic lung. In normal lung, what is happening is the muscles, they are very relaxed and there is a normal lining and normal amount of mucus production in the airways. But in case of asthmatic lung, the muscles they tightens, and due to the inflammation, so it is a chronic disease which is characterized by the inflammation in the airways. So due to the inflammation, the airways swollen and they become very sensitive to a variety of stimuli. So the airway obstruction is maybe due to smooth muscle spasms in the wall of the smaller and the bronchioles. There is an edema of the mucosa of the airways, and there will be an increased or excessive production of the mucus that will lead to the damage of the epithelium of the airways. So here you can also see that there is a excess secretion of mucus and there is a swollen lining which has been seen here. Now the symptoms of the asthma, that will include breathing, difficulty in breathing, there is a coughing, wheezing, there is a chest tightness, and there is a moist skin, anxiety and fatigue. So these are some of the symptoms of the asthma. Then Amsemia. So what is it? So it is a disorder which is characterized by abnormal enlargement of the air spaces due to the destruction in the walls of the alveoli. So alveoli, they are present in the lungs. So as you can see, this is a structure of the lung where the alveoli are present. So then there is a magnified view that how this looks like. So if you talk about the normal alveoli, so they looks like this, and in case of the uh, Amsemia alveoli, they looks like this. So there is a destruction of the walls of the alveoli. The lungs become fibritic and less elastic. So with the less surface area for the gas exchange, there is a O2 diffusion across the damaged respiratory membrane which is reduced. It also causes an increased amount of air trap in the lungs at the end of exhalation. So this disorder is generally caused by a long-term irritation. There is a cigarette smoke, there is a air pollution, and there is a occupational exposure to the industrial dust, and these are some of the common irritants. So that is a long-term problem which has been caused. Now about the bronchitis. So this is also a diagrammatic representation of a lung, that how it looks like. So bronchitis, as the name suggests, there will be an inflammation in the bronchi of the lungs. So as you can see, there is a left side of the lung or left side of the body here, there is a normal bronchial tube. So it looks, there is a normal lining, there is a normal functioning of this tube, bronchial tube. But in case of the bronchitis, there is a thick mucus which has been there, and there is an inflamed lining of the bronchial tube. So it is basically of two types. What are the two types? The two types are the acute bronchitis and the chronic bronchitis. Now what are these? So acute bronchitis, it's also known as the chest cold, and it has a cough that lasts around 3 weeks. So in acute, it lasts for a very short term, but in case of the chronic, acute lasts for about 3 weeks, and it is a short term inflammation of the bronchi of the lungs, and it in more than 90% of the cases, basically the cause is the viral infection. So in acute, there is a possibility that it is because of the viral infection, and it will be treated within the 3 weeks. But if we define the chronic bronchitis, then it is a productive cough that lasts for 3 months or more per year for at least 2 years. So it lasts for about more than 2 years. So that is the chronic bronchitis. Now cigarette smoking is one of the main symptom or main leading cause of the chronic bronchitis. The other symptoms include the frequent cough, tiredness, fatigue, wheezing and noisy breathing. Then there is a shortness of breath. There is a chest pain which is accompanying coughing and deep breathing. Then fever with chill and body ache. There is a sore throat, running nose with or without stuffy sinus and headache. So these are some of the symptoms of the bronchitis with a diagrammatic representation that what is happening in the bronchial tube. Pneumonia. So pneumonia, it is an inflammation of the alveoli of the lungs. So here is a diagrammatic representation, and here it is a magnified view of both the normal alveoli and how the pneumonia looks like. So this is a normal alveoli, and in case of pneumonia, there is an inflammation of the alveoli of the lung. So the typical signs and symptoms include cough, chest pain, fever, and breathlessness. So its symptoms can vary from mild to severe. There are many factors that affect how serious pneumonia is, such as the type of germ which is causing the infection or your age to overall health. That can also be the factors that is affecting the pneumonia. So pneumonia is usually caused by the infection with viruses or bacteria, and less commonly by the other organisms. So here I have given the example of the bacteria, that Streptococcus pneumoniae. It is the most common cause of the bacterial pneumonia. So this was about the pneumonia. Next is about the tuberculosis. So tuberculosis is an infectious disease caused by the bacterium Mycobacterium tuberculosis. Although several Mycobacterium species can cause tuberculosis, M. tuberculosis. So M. tuberculosis is the principal causative agent here. So tuberculosis generally affects the lungs. So you can see here that the person here is having the active tuberculosis infection. So the person may be having the chronic cough, which may last for about 1 year or 2 years with blood containing mucus. So they, when they sneeze or when they cough, there is a blood which has been coming out. So this is an infected lung, and there is a Mycobacterium tuberculosis which has been represented here in a magnified view. So it generally affects the lungs, and once the bacteria inside the lungs, they multiply and they cause the inflammation, which stimulate the neutrophils and macrophages to migrate to the area and engulf the bacteria to prevent their spread. If the immune system is not impaired, the bacteria remains dormant for life. But impaired immunity may enable the bacteria to escape into the blood and lymph to infect the other organs. So in many people, symptoms, for example, there is a fatigue, there is a weight loss, then low grade fever, there's night sweats, cough, chest pain, breathlessness. So these are some of the disease symptoms which are because of the disorder of the respiratory system, that is the tuberculosis. Now these are some of the references. Thank you.